Hi, hello once again. This is your psychiatrist Indra Cidambi from the United States of America. I am here today with a new topic. This is all about addiction, right? So one of the viewers asked me, what is addiction? And have you ever thought about why it's so hard for someone who struggles with addiction to reach out and ask for help? So let me dive right in and try to answer this question. The major obstacle is stigma. So just to be clear, this is not a full treatment, but then I'm going to talk about a bigger picture about stigma. So it seems like how one views addiction. Is it a disease or a moral failure? It makes a huge difference how we view. That is where the treatment stands, right? So destigmatizing addiction is the most important thing. So, let me give you one thing, like addiction is really misunderstood. This misunderstanding leads to all the stereotypic view of this, right? So what are the stereotypes that I'm talking about? What are the ones that really hurt people? The misunderstood part that gets me, so look at this misunderstanding and all the judgments that follows that. So they lack willpower. So they say that they lack willpower. They are the ones to be blamed for their situation. And those assumptions completely disregard this very complex interplay of biological, genetic, and the social factors that lead to addiction. The genetically predisposition can really make some people more predisposable to addiction than the others. It's not the moral failing or character flaw, it's a complex chronic disease. So the cycle of shame and isolation, that is the cycle that you want to look into. So imagine feeling trapped by this thing that you're battling, and on top of that you are consumed by this shame, and the shame becomes like a wall between you and getting help. So you don't try to reach out, and so you isolate yourself, and the isolation is the field, growing field for addiction, because that's a fear of judgment. That's a huge barrier. So that's really heartbreaking. This is a vicious cycle again, Knowing how damaging the stigma is, how can treatment centers, how can they break these barriers? It's just like they need to use the language barrier. So they need to create the safe space. So throughout our treatment, in my experience, high kind of personalized treatment. The addiction is often treated as a one-size-fits-all. The traditional models, a lot of them, even with the best intention that they have, will reinforce the shame and sense of shame. So the non-judgmental environment is the only way you can really fight this. I'm talking about the outpatient versus the inpatient. The inpatient really, kind of waters this punitive, stigmatic way. Not all of them, but majority of this. This is the olden way. But I think this outpatient detox really just make it such an easy, user-friendly, because the accessibility of treatment and reduces the fear. So the outpatient detox allows the individual to be able to approach, ask for treatment, and be able to entertain this treatment, and they're not terrified, because it makes recovery so much more achievable and less intimidating. It's not just about endorsing one treatment over the other. It's about understanding the larger issue of stigma itself. So this is the final thought for you guys. What can you do to challenge your own biases about addiction? How can we as individual, as community, can really support understanding addiction and promote treatment, and not judging, and not bringing in our pre-formed notion into treatment, saying that, oh, you cannot do it as an outpatient, you need to go as an inpatient, whether it works for that person or not, and not saying that, oh, you cannot replace one drug for the other when they have to go take MAT treatment, which is the medication assisted treatment. So giving all these kind of feedback, not knowing what is going to work for this individual, is going to be detrimental, because with all the love and care, one might not get the loved one the appropriate treatment. So I leave you with this note and this thought for you to think, how much is my bias going to intervene my loved one from asking for help and staying sober? What is my contribution in this addictive whole treatment and the journey of addiction? Am I overwhelmingly trying to be protective? And am I adding to the stress that my loved one already is going through? So that's a good thought. Hang in there till the next video of mine. See you then.